Hello, my name is Stephen Munatones. I'm the CEO and co-founder of KAATSU Global, and I thank you very much for participating in this webinar. It'll be mostly Q&A. Um, I will be joined by our Chief Performance Officer, Chris Morgan. He is actually going to be our Chief Science Officer after he completes his PhD in KAATSU at the University of Lausanne, where he actually did his research on cardiovascular issues. It's a follow-up study and research on the very groundbreaking work that Dr. Nakajima, a cardiologist, Dr. Morita, another cardiologist, and their team got together with Dr. Sato in the early 2000s, and they did a detailed research study on over 12,000 patients at the University of Tokyo Hospital, mostly older, many of whom had cardiac issues. That's how they were initially recruited into this project. And those protocols that we use, those protocols that they developed, tested, researched, and documented are the exact same protocols that we use today. That was a 10-year project. Once it was over, then we began KAATSU Global. And the reason why is we wanted to make sure that with anybody with cardiac issues, we and they knew how to use it. So I'm going to introduce Chris. He's let's see, Chris. Can you? I don't see you. Let me see. And I want everybody to see your face. Here we go. Oops, I think I hit the wrong person, but it's okay. What about that? There we go.
Hello, can you hear me,
Yes,
Stephen?
yes, I can hear you.
Yeah,
Um,
I'm not sure why I'm here.
okay, but well, for those of you who have been on this these webinars before, we know what we remember what you look like, Chris. But maybe explain not how you started, Chris, because that was Chris. You started with KAATSU actually before we even started the uh, corporation. But tell them what your focus of your PhD dissertation is, what you've found so far, who you're working with. Um, for those of you in the United States, Chris and I initially were working with Dr. Aaron Baggish. He is a renowned cardiologist, originally from the Harvard Medical School, where he did a lot of groundbreaking work with understanding how apparently healthy, active young athletes were having cardiac issues. Um, his clinic continues to this day. Um, uh, Dr. Baggish was, among other things, a team doctor for the New England Patriots. He was a head chief medical officer for the Boston Marathon for years. He was a former marathon runner himself, Olympic trial level, and then he was recruited by the IOC, and he's now at over at the University of Lausanne in Switzerland. In addition, Chris in his previous life was a very high level, Olympic level swim coach. And one of his swimmers um, is actually now his mentor at the University of Lausanne. So, Chris, maybe explain what you're doing, who you work with, how you go about, and then we'll go.
Yeah, no, thank you, Stephen. You can hear me too. And what I may
Yes.
do is, after I present myself and a little bit what we're doing, is I might try to log out as a guest and log back in as a co-host. That might
Okay.
work.
Yeah.
But
Yeah.
and I'll let you. So yeah, real interesting, and appreciate everyone's time and anyone who comes to listen to this after. When we think, Steve, before I talk about what we're studying, just the impact that KAATSU has had, is having, and will have. What a lot of people, and on all of our previous webinars and a lot of our documentation, we always think of KAATSU with muscle. Our both of our mentor, Dr. Yoshiaki Sato, was a very experienced and very passionate bodybuilder. So because his initial interest was in muscle building and healing, it's of course also something that's important. But what's even more incredible, what we're understanding, and it's all happening really at this ironic and iconic time where a lot of research papers are coming out about what we can do with KAATSU at the cardiac level. And what I mean by that is not only taking care of our most important muscle, our heart, but also when we've had some kind of traumatic cardiac event, whether it's a heart attack. And what a lot of people also need to understand when we talk about a heart attack, there's two different kinds, right? There is a heart attack, and then there is cardiac arrest. One is more of an electrical issue, and one is more of a plumbing issue. So you think about your electrician and your plumber, both are very important. So what I was very interested in, and I appreciate you mentioning Dr. Baggish, who's again very, very, very knowledgeable. And when we first met him, Steve, and hopefully this is okay to say, when he met us or first met you at the Harvard swimming pool, you might recall, he said, "My doctor hat, I'm very not skeptical, but very cautious about this KAATSU and putting these pneumatic bands that you see Stephen has right now on his arm." And his cardiac mind was very cautious, whereas his athlete brain was like, "I get it right away." So the fact that he was a high level athlete, and I think that's where he's a very important person in our journey, because he understands the not only the importance but the impact. So yeah, I sort of came up with the thought of wanting to know how we can help people, yourself included, Stephen, who had a cardiac event, how we can use KAATSU as a rehabilitation tool. When we think about going to a PT after an injury, again, in the layman's world, we think about somebody who has a torn ACL, whether they're a professional athlete or our mother or father walking up or down the stairs. Or we think of tennis elbow, going to a physical therapist. We think of things like a cut or a bruise, and how we use cold or pharmaceuticals. But I think what I was interested in is really understanding, how can we use KAATSU for cardiac rehab. So that being said, what I had learned, again, not only from you, I appreciate everything you taught me, but learning from Dr. Sato, is the importance of the KAATSU cycle. There is the other modalities that are out there of a more generic BFR that uses a constant pressure. And what I knew from my own self experimentation and experiences is that the KAATSU cycle was the magic. That was what was very important. And as you mentioned, all of these years and years and years of studies by Dr. Sato and Dr. Nakajima at the University of Tokyo. So what we did is we looked at three different cohorts of people. Usually exercise is already an accepted and recommended form of rehabilitation for a post-cardiac event. And this could be a valve replacement, Stephen. It could be simple angina, I shouldn't say simple, but very different levels of cardiac rehab, and where exercise is already quite encouraged. But what I wanted to see is, how beneficial could that cardiac rehab be with KAATSU, specifically the KAATSU cycle, and could the KAATSU cycle replace exercise altogether? So we are looking at still finishing up the study on those three different cohorts of post-cardiac patients, those doing exercise with KAATSU in the cycle mode, and those doing KAATSU cycle only. And what we are really excited about is, and this some people listening to this might see, well, hey, that's very simple. But what's incredible is all three we've shown to be very beneficial. But surprisingly, KAATSU with exercise with the KAATSU cycle is the most beneficial. And KAATSU cycle, and once I log out and log back in, Stephen, I'll be able to show you the KAATSU cycle. Sorry, the KAATSU cycle only was almost equal to exercise itself. So it's a win-win-win, in my opinion, where we're seeing exercise good, exercise with KAATSU cycle better, and then KAATSU cycle alone. And the reason why that's really important, and I'm hoping that this will be a catalyst for many, many more studies, is some people after a cardiac event, especially if it's in the more severe or um, uh, extreme situations, is some people can't exercise, right? As we know, whether it's due to weight or other secondary injuries. So if we can now help these people with just the passive KAATSU, which is what you're doing right now, Stephen, as you're helping me with this webinar, is you have KAATSU in the cycle mode. I imagine it's in the cycle mode. I can't see
Yes.
your arms, but
Yes.
yeah, yep, that's blue light cycle mode, everyone. So it's really, really exciting. So kind of backing up, and then I'd like to show. I'll log out, Steve, because I really want to. I think if I log in as a host, we'll be able to see it. So why don't I do that, Steve? I'll
Okay.
log out, and then
All
I'm going to
right.
log back in. So I'll be right back to everyone. Thank you. Be right back.
Okay. So, just to continue what he said and the protocols that we use for people with cardiac issues, they did come after a 10-year formal study of KAATSU, and that was actually preceded by another 10 years. So there was a total of 20 years of looking at how people who have had a cardiac issue or have a cardiac issue or have a propensity maybe maybe their parents had a heart issue, um, how they should use KAATSU. And Chris pointed out, and he did see the little blue light. And I apologize for this lighting. I'm actually in Japan this week, meeting with cardiologists. And so the issue is always use the KAATSU cycle. Always be well hydrated. No need to do vigorous exercise, whether that's a push-up, a burpee. And for some people, a vigorous exercise could be walking upstairs. So as you see during this presentation, I'm simply sitting down in a hotel room, speaking with you. I will answer your questions, and the KAATSU is going 30 seconds on, 5 seconds off, 30 seconds on, 5 seconds off. I started it about a half an hour ago. I will continue. I am on low pressure. I started. I'm now on medium pressure. And I generally don't go to high pressure. I never, almost never do go to high pressure. I only do it for demonstration purposes. So Chris will be logging back in. And in the meantime, I will answer questions that are coming in. The first question is a very simple one, and it doesn't have a simple answer, is how to use KAATSU with heart failure. So the first and primary recommendation, how to use KAATSU with heart failure, is to discuss it with your doctor or team of doctors. Number one, absolutely show them, him or her or the team, what the product is. Literally take it to the office, or if you're in the hospital, as I was literally in the hospital on a bed with tubes coming out of my ears. I asked my wife to bring the unit to the hospital. I showed it to the doctor, to the nurses, to actually everybody who walked in the room because I wanted to do KAATSU because I had just finished this 20-year training program or mentorship, not finished, it's still ongoing, this 20-year mentorship with Dr. Sato. And I had seen him and Dr. Nakajima, Dr. Morita work with people who had heart attacks, strokes, stents implanted, etc., with KAATSU. And I myself, in this very vulnerable position, wanted to do it. So what I did is I showed it to the doctor. At that time, I attempted to explain it to the doctor. My American cardiologist said, "No way, no how. You're not going to use that. It's dangerous." And so I literally followed his instructions. When I was discharged from the hospital, I called Dr. Sato, and in consultation with Dr. Nakajima, I proceeded to start KAATSU cycles, following all of the protocols that they had previously taught me as a student of theirs. So, how to use KAATSU with heart failure? One, talk to your doctor. Um, Two, show them the unit. Three, show them how it works. Their automatic, I can guarantee you, their automatic response is that's a tourniquet, and nobody with a heart attack, stroke, a stent implant, a-fib, you name it, will put a tourniquet on their arms or legs. We agree, 100% agree that you should not be occluding or cutting off blood flow to any of your limbs, especially with a cardiac issue. 100% agree. So that is why an explanation, in addition to a showing of the unit, is important. And what I mean by showing the unit, you literally show them the cycle, show them how the band fills up with air, show them that the duration is short. I'll turn it off so it doesn't bother anybody with the sound. And explain that the inflation of the bands, the very brief inflation of the bands, leads to blood going in normally and simply a slowing down or a modification of blood flowing coming back. That's temporary. It's brief, and is gentle. So once you do all that and you explain to your physician, show them the unit, show them how it works, then you listen to what they say. In my case, I did listen to what my cardiologist said, which was no way, no how, not here, not in the future. And then I sought a second opinion. I saw a second opinion from the very doctors who developed this, to the very doctors that I stood next to and listened to. And then I continued to proceed with the units, which is be very well hydrated, be seated, or you could be supine, you could be lying down. Um, start on your arms, then proceed to your legs. Always do low pressure. Always do KAATSU cycle. For some people, you can do a one finger tightness, but I would recommend a two or three finger tightness. And don't do it like I attempted to do right after when you're still in the intensive care unit or critical care unit. That's unreasonable. I agree. Myself, I was unreasonable, but I was just so excited to use myself as the American guinea pig because I just seen what Dr. Sato and Dr. Nakajima had done. And what does this do? All of this stuff, what does it do? When your blood goes into your arm or your legs and it is slowed down coming back, that does not mean it stopped. Does not mean it stopped. It simply means if you can imagine a river and you have a river flowing, Mississippi, it doesn't matter what it is, a river flowing, and then the river narrows. When the river narrows, as you're doing with the KAATSU bands, because the KAATSU bands are compressing uh, uh, the circumference, as the river narrows, the flow of water, or in this case, our own bodies, the flow of blood does not stop, it simply slows down. And when it slows down, that begins an engorgement of blood in the capillaries and veins of your arms or legs. When this happens, the blood vessels, your capillaries and veins, expand as they should. That's how we evolved as humans. They expand. And when they expand, this is a good thing. It's not at a dangerous level. It's simply at a reasonable level. When it expands, that's where the excess blood is stored. But again, it's not stopped. It's just a flow. It's a slowing down and then a speeding up. So slowing down and speeding up. Now, the magic comes, or I shouldn't say the magic, the benefit comes, the physiological benefit is then when the blood is slowed down or the flow is slowed down, and then the river or the bands deflate and the girth of your arm increases, then that flow of blood increases, just like you would see in a river. Flowing river, it slows down, the river banks widen again, and then the flow of water continues on. When that flow of blood continues back to your torso, it creates shear, it creates friction against the sides of the vascular walls. And this creates, we call it, acronym is VEGF, or vascular endothelial growth factor, the cells that line the inner part of your vascular tissue, it produces those. And those are the things that allow your vascular tissue to expand. It's not exploding, it's simply stretching a bit. And that's a good thing. And that's why Dr. Sato and Dr. Nakajima looked at KAATSU because they were looking at the human body, especially those with cardiac issues, to help improve their vascular circulation, their blood circulation. They're helping to make the vascular tissue stronger, more resilient. And we want that, especially after a heart issue or actually before a heart issue, in addition. So that's what they were looking at. And for the first question is how do you use KAATSU with KAATSU? How do you use KAATSU with heart failure? That is just a general synopsis. Now, of course, there'll be issues about age. There'll be issues about existing conditions. There'll be um, issues about what medicines, what treatments are they looking at. And so that is why you speak with your cardiologist first, get his or her opinion, and then proceed with the treatment. So, Chris, I was just answering the first question. We have lots of questions that are coming in, but when you were logging
Yeah,
off, I
and I apologize again. So
well,
I'm going to just share my screen, Stephen, real quick.
yep, yeah,
Hopefully,
go ahead.
uh, hopefully, hopefully I can actually share my screen. You'll let me know. Are you
Yep,
seeing my screen?
yes.
Great. So just again, a couple slides for everyone that may help this. Excuse me. I'm just going to hit here. So again, just talking about KAATSU and cardiac rehabilitation, right? That's what we're interested in today. It's very specific to one of the very interesting and more impactful things that I believe, Stephen, we can do with KAATSU. So when we talk about muscle, right? This is the muscle. So the most important muscle in the heart is the heart because it pumps blood and oxygen throughout the body, which is essential for our survival. And again, I think I know the story, Stephen, because that you shared because I was there.
Yeah.
When we think about exercise, just this is a nice little slide to how we think of exercise, right? Whether we're weightlifting or doing some yoga or some squats, some jump rope, all different kinds of ways we think of exercise. And this is how we should think of exercise, really splitting up into this sort of cardio, strength, and then KAATSU training, right? And how KAATSU training can actually be its own modality of exercise. Conditions that often require cardiac rehab, Steve, anywhere from a heart attack, heart failure, heart surgery, and onward. So PCIs, if you're familiar with that, any kind of heart disease or peripheral artery disease, blockages, which a lot of people might not even know they have, Stephen. So these are sort of the things that can lead to why we would even find ourselves in a situation of cardiac rehab. And what are the benefits of that cardiac rehab? Well, you see this nice little heart hugging itself. Well, it improves your ability to perform daily activities, reduces your risk factors for further heart disease, strengthens your heart and body. Again, heart being the muscle, as I called it, helps manage symptoms and it can improve your mood, right? And we talk about just a little side note is how we both know, Stephen, you and I, that KAATSU actually makes you feel happy, right? It can actually affect your hormones and it brings a feeling of joy. It provides education on managing your heart condition as we age for healthier habits. So, and we've already started to touch on this, but just how can KAATSU play a role in this? And this is actually just some photographs of people from our own website doing very different things. People from all walks of life, from some kettlebell work, which is more people say, well, that's not me. But then we see this, you know, gray-haired gentleman, probably between your age, Stephen, and my age. We're both young, and this woman, who's obviously in her elder years, looks like she's out for a track run, but has her KAATSU Bluetooth on, and then even swimming. So how can KAATSU play the role? Well, again, Steve, I apologize that I left for a little bit, and I know you already explained this, but this is a very nice animation that we've showed on earlier for exactly what Stephen said. If you look at, well, as I'm looking at my computer screen on the left side, this is sort of the capillaries in the fingers before applying that KAATSU airband pressure. And then the diagram on the right side where you see this pneumatic elastic KAATSU airband, and you see this engorgement of the microcapillaries. This animation is just exactly what Stephen said. So all of our plumbing, as we call it, is lined with these cells, and it's this increase in nitric oxide, which we've discussed in other webinars. I won't waste our important time here today, but this nitric oxide, which then leads to this increase in vascular endothelial growth factor, which, as Stephen said, gives this incredible, gives a now known increased elasticity to our arterial walls, venous walls, etc. And then again, as Stephen mentioned, how does KAATSU work? But by impeding, not occluding blood flow, and actually simple exercises, even just bicep curls with no weights in your hands, can actually become unsustainable. It's this disturbance of homeostasis transmitted to the brain, which releases, again, healing neurohormonal cascade also for our heart, and importantly for this discussion, for our heart. And since little damage is actually done, we improve muscular skeletal structure and function. Muscular, the heart, right? So the big muscle. And Stephen, you stop me at any point. This is really important, again, from a lot of our information for everyone out there. KAATSU pressure is not arterial blood pressure, right? Most of our most lay people will see a KAATSU airband, especially on the arm, and mistake it for a blood pressure cuff. A blood pressure cuff is designed to do exactly the opposite of a KAATSU airband. It is designed to impede blood flow so that the medical practitioner can have two different pressures, pressure normal, and then when we occlude the blood flow, so you have the systolic and diastolic, or the diastolic and systolic pressures, to then get a difference between these two pressures for our blood pressure. So KAATSU pressure is applied to the veins and moderates venous outflow. Moderating the venous outflow eventually modifies arterial inflow. Blood flow into extremity must soon match blood flow out of the extremity. However, there are some capacitance for holding extra blood in the extremity, but once that's reached, the blood flow must match the flow out. So a little bit nerdy science on what's happening, but it's just important to know that, Stephen, it does not have to do with our blood pressure. Now, KAATSU will affect in good ways our blood pressure, as we'll look at in just a little bit here. So the blood flow with KAATSU, when a muscle contracts, I have to move my own face so I can read my slide. When a muscle contracts, pressure in that muscle can reach high levels. They squeeze any blood in the muscle, as Stephen explained, or vessels in the muscle back into the major arteries and veins. Veins have valves, Steve. We've talked a lot about this, how even exercising KAATSU can exercise those valves. When we talk about varicose veins or spider veins, we're actually exercising those valves to improve the efficacy of those valves. So those valves which flow blood to flow only in one direction, back to the heart, right? Or heart, we keep talking about it. And with KAATSU, the veins are holding lots of blood. And with muscle contraction, that blood is squeezed past the pressure, uh, the pressure and the moderation of the band. Back to my slide here. So we've talked before, and Steve, this is one of our old slides that I just brought back, exercise from the inside out, improving that vascular elasticity, right? Very important for our heart health, right? Our heart is pumping through all of these veins and arteries, why we want these veins and arteries to be very elastic and very healthy. Also, it strengthens muscles. We'll save that for another webinar. Again, the muscle of the heart, the most important, and then increasing our aerobic capacity, whether swimming, walking, swimming, walking, or even simple squats or our 3-point exercises. So 2 recent studies, Stephen, just kind of really important for people to know that these studies, and again, how I said ironic and iconic that these just came out recently as I'm finishing my work as well. One study, the study just out in November this month about, and we're going to dive deeper into that one about blood flow restriction training, KAATSU specifically. I'll talk about that. Improves cardiac structure and diastolic function in runners with EIH, so just exercise-induced hypertension, right? As you exercise, your blood pressure goes up. And then another interesting study that just came out, this was actually done in Iran, heart rate variability and blood pressure response to low-intensity endurance exercise training, plus blood flow restriction in individuals with mild hypertension. So just a randomized controlled clinical trial. That was done in Iran. But this first study I mentioned, Steve, very interesting, where not only was the study done using KAATSU, but using the KAATSU cycle. So in Korea, where there's been a lot of research, Steve, in the past as well, but this specifically because they use the cycle. So it was performed in Korea. The study looked at what we refer to as EIH, which is exercise-induced hypertension for the layperson, just high blood pressure in specifically, this was long-distance runners, but KAATSU equipment was used for this, quote, BFR, for the generic term BFR, but it was KAATSU equipment using KAATSU cycle. I won't bore our audience today, but this slide just briefly talks about the study, what they did, what they were looking for. The KAATSU cycle mode was used, and as you mentioned, Stephen, before, we now know from the studies of Dr. Nakajima about this vascular endothelial growth factor. And specifically, I know, Steve, you talked before. Steve, could you just mention to our group here today about how much our veins and arteries, it's quite an intricate system, correct?
Yes. So we know that our capillaries and veins are located throughout our body. And if you took the total length of your arteries, the total length of your veins, and the total length of your massive system of capillaries, and you lined them up end to end, it is estimated that that would circle the Earth 2 times. That's how many miles or kilometers of vascular tissue we have. And it's all from our toes to our brain. And so, especially if we're talking about aneurysms, heart issues, et cetera, clots, we want to maintain that elasticity of that incredible, ubiquitous network of vascular tissue.
Yes, thank you, Steve. So, sorry. Uh, Here is just interesting on who this study, as I went through as well with my study, you have to start and get a group of people. The group was narrowed down to 40 individuals, and then meeting different criteria. They looked at an exercise test and finally ended up using 29 individuals. One group of individuals were in the BFRT group, blood flow restriction, but it was KAATSU training, and the other was no KAATSU. Both groups in the how they did the study were a very simple study. We also used a treadmill study in our study, Steve, that I'm currently finishing up. Very, very good test is good old treadmill, right? They use two 20-minute sessions over 8 weeks. Again, they use the KAATSU cycle mode, starting at low pressures. And what's really encouraging, Steve, is I believe now, after doing a deep dive on this study that I'm showing here, that these individuals did their due diligence on studying all of the protocols and procedures of Dr. Nakajima and Dr. Sato. And I think that's where, for us, as of course, KAATSU, we see that when people follow our protocols, good things happen. To put it in simple terms. So now to the next. Oops, let me back up one slide. Excuse me. So conclusions really important. KAATSU training, and I'll read through these, Stephen, if that's okay. So KAATSU training was shown to mitigate excessive blood pressure during controlled exercise for runners with this EIH. So wow, that's sort of, for me, that's a light bulb going off on my head, above my head. Very importantly, KAATSU was also shown to improve cardiorespiratory fitness, so CRF. And CRF is defined as the ability of our circulatory and respiratory systems to supply oxygen to skeletal muscles during sustained physical activity. So again, wow. So not only our heart health, our big muscle, the muscle, but our skeletal muscle as well. And I forgot to mention earlier, Steve, again, anyone who does have a medical background listening, um, a lot of people will know even better than me that there's a lot of smooth muscle that is surrounding, and this is how I explained it to my mother about KAATSU, is when you think about all of that, the veins and arteries, Stephen, that you mentioned, and imagine how much smooth muscle is also being affected. So again, another aha thing for us to think about. EKGs were used and indicated reductions in interventricular septal thickness. So a little bit about that is a thickened septum can be associated with a higher risk of certain conditions such as coronary heart disease and myocardial infarction, right? So a heart attack. So we are actually slowing down as we age, Stephen. That thickness increases, so we're actually slowing that down. I'm not knowledgeable enough to say that we are reversing this, but certainly in the study I'm doing as well, when we talk about health span and lifespan, we are increasing our health span, which will increase our lifespan. So slowing down that thickening of the septal thickness. The results of this study indicate that KAATSU training may be a good non-pharmacological modality capable of improving cardiac function and structure in runners. And most important, research is next is to determine how the average person can benefit from KAATSU. On my next slide, this is more talking about, now, Steve, what I realized is until my study is published, I can't show all of the information publicly, but I'm certainly allowed to just show what we're really looking at. So we finished 14-week study, 38 participants, and then we had these three separate cohorts, which are on the bottom: exercise only, exercise with KAATSU cycle, and then KAATSU cycle only. And above that, you see primary things we were looking at: heart rate, blood pressure, EKG, also EKG, very important, and oxygen saturation. So really interesting things came from that. Stephen, you're going to be really excited when I show you some of that. The oxygen saturation improving quite significantly. And then secondary measurements, VO2 max, always something for exercise. Simple blood work where all kinds of neat biomarkers can be detected in just simple blood work post the 14-week and pre the 14-week and post 14-week. Body weight, something we looked at, and then just other vitals, including perceived rate of exertion. As we were doing these exercises, we were using this perceived rate of exertion just to see any changes. And that was also quite an interesting thing, Stephen, to see people's perception of exertion actually decreasing the more they used KAATSU. So, but as you and I both know, that would make sense. So just kind of my final slide, and then Steve, certainly open to your questions. I just called it the final word is, can KAATSU training be an additional modality for cardiac rehab? It's a question I ask the audience. It's a question I've asked, and I know I have the answer now, and my answer is yes. Can KAATSU help with our own longevity? Great question. My answer is yes. And can KAATSU and health span versus lifespan be affected? Certainly, as I mentioned just a few minutes ago, yes. And most important, is KAATSU safe? And we know, following all of our protocols, I can't emphasize enough that when you follow the protocols and understand the equipment, show it to your doctor, your medical practitioner, as you mentioned before, Steve. It's certainly, after decades and decades of development, it is very safe. So I'll stop sharing. That's just some quick slides, Steve. Hopefully that was a little bit helpful for what's out there, what we're doing. And I see we've got some questions.
Okay. So yeah, we have several questions. I'll go over the uh, cardiac related questions first, and then I'll get to the non-cardiac questions at the end. So the first cardiac related question was how to use it with heart failure, and I explained that previously. Second question is there a coordinator or someone who can help new clients who have purchased KAATSU? Yes. So if you have any issue, you can call our 1-888 number that's toll free, and it's on the bottom side of our website. Next question is, I'm 82 and I have a a-fib condition. Can I use KAATSU? Um, the answer is yes, you can, but always make sure that you explain what KAATSU equipment is and how to use it to your own medical professional. It's absolutely the very first thing you should do. If your cardiologist or health professionals do not know what KAATSU is, that's okay. We have a variety of materials that we do provide to cardiologists or any healthcare professional. And so we can send it to them by email. Um, we can send them specific studies if they would like. If they have a specific question, we can send them available information. So the answer is yes, you can, but make sure that you follow up with your own medical team and explain to them how you're going to use it. I explained previously, low pressure, cut cycle, no vigorous work while you're doing it, and just allow the compression and decompression to help your vascular tissue become more resilient. Um, but the next question is, why do you never go to high pressure? Which is a very good, very simple question, but very, very common, very profound. I personally never go to high pressure because it's not necessary for me. Um, eh, I think, especially as Americans, especially as competitive athletes, we just assume more is better. If it hurts more, it must be better for us. And that is definitely not true with KAATSU. KAATSU is best when the pressure is appropriate to you. And how do you determine what is appropriate for you? And that is why we use the KAATSU cycle. KAATSU cycle starts out at a low pressure. That may be very appropriate for someone who is in their 80s and has a-fib, or perhaps somebody who has a stent, perhaps somebody who's had an aneurysm, etc. But everybody starts at a low pressure, quite low. So if we're thinking about that analogy of a flowing river and the banks narrow and things slow down as the blood is coming back, for these people, we we don't want them to be doing vigorous work or high pressure when their banks are very, very narrow. We don't know that. That's why your medical professional will know your calcium score. He or she will know what medicines you're on and why, very importantly. And therefore, working with you and your team, we can put something valuable to you. Now, going back to the original question, why do you never use high pressure on the KAATSU device? Because in my case, I don't need it. For me, starting with low and then proceeding to medium is very, very appropriate for me. My hands or my feet get very red. I see that I have very quick capillary refill time. So, I don't have the bands on now. When I have the bands on and I push my forefinger or thumb into the base of my hand or right above my knee, the blood comes back immediately, very much faster than 1 second, probably a, a, a fourth or a third of a second. So I have in these cases with the medium bands put on with the one finger tightness while I'm well hydrated results in the optimal engorgement of blood in my legs and arms. That is affected. I know this when I am at high altitude. If I go to Colorado Springs, if I go to Park City, Utah, if I go anywhere in the Rockies, Rocky Mountain areas, I know that the higher elevation will impact how my body responds. So I go slightly lower. I know if I traveled, if I've not been well hydrated, if I sat on an airplane as I was a few days ago on the tarmac for hours, there was nothing there. I had gone to the airport, I had drunk nothing, consumed nothing. So I was I hadn't anything to consume in let's see, 7 hours. So I knew I was dehydrated. In this case, just sitting on the airplane, I put my COTS bands and I only went to low pressure because I was dehydrated. As soon as we took off, got the airplane up at altitude, the stewardess was able to come, asked for 2 glasses of water or 2 cups of water. They gave it to me. I wasn't fully hydrated, but I was more hydrated than before. Then I could do KAATSU again. Kept it at low because I didn't need to, but I don't personally need to go to high pressure. If the low pressure or medium pressure is suitable to get engorgement of blood in my limbs, then that is appropriate for me. Next question is, I developed heart failure over the last years or so. I was using KAATSU with biking, walking on a Schwinn Airdyne, and Indian club exercises. Last week, I got admitted to the hospital due to shortness or difficulty of breathing. I had no heart attack, but lots of edema in my chest, abdomen, and heart. I'm going in tomorrow for cardiac cath cath Go, gonna get stent if needed, but definitely meds for management. I typically use KAATSU 3 times on my arms at a low, medium, and high setting, and legs only on the Schwinn bicycle. Um, and the question is, I'm not sure what the question is. Probably, should I continue using KAATSU? I would assume. Um, uh, so this is a perfect example. Here is a CUTS user for years. He appears to be have used the KAATSU quite well, always starting on low. He's doing it in his arms and his legs, doing a variety of exercises, excuse me, biking, walking, and the Indian clubs, a resistance exercise, all very, very good. But unfortunately, he has shortness of breath. And so and he has a lot of edema in his chest, abdomen, and heart. So he should stop using KAATSU for the time being. Allow the medical professionals who are doing blood tests, who are putting him through a variety of tests to understand what the issue is and for him to understand their recommended treatment plan. KAATSU can be a part of that treatment plan. If I were this gentleman, I would also want KAATSU to be a part, as I did when I was lying on the in the critical care unit. But I also wanted to get as much information on my current situation as possible. So I think that's where you are now. You are a long-time user. You have some issues. You want to get a handle of those issues. You want to get a better understanding of what you can do to make your body better, and then incorporate KAATSU into that with the knowledge of your medical team. So that's what I do, and that's what I would do if I were you. Those are my recommendations. Um, next, let's see. Oh, next question is, how can you tell that your heart muscle got improved after KAATSU practices? So there are various tests that you do with blood. You can also do very simple things. One of the simplest things that we did at the University of Tokyo Hospital is see on a stationary bike, on walking, if you were able to handle the same amount of work. So let's say walking at a pace of 4 or 5 kilometers per hour or 2 or 3 miles per hour, doing various things. They can do uh, uh, blood tests. They could do VO2 max tests. You can simply time yourself walking around the block. So use performance parameters. And the blood test will test for a variety of things. In my case, um, I asked my cardiologist who put a titanium stent in my artery what was because I didn't have experience it with my own body. So I asked him like when this stent is in there, when will it get covered up with the vascular endothelial cells since it is part of me now? And he said about 18 months. But I also knew that uh, with KAATSU, your body produces VEGF or vascular endothelial cells. So I was just quite curious. I wanted to see a test if that was in fact improving. And in fact, it did improve. It made me happy. Dr. Nakajima, Dr. Sato, when I explained to them, they were looked at me like, why would you test that? Because we know it's true. But anyway, just for my own self and my own self-satisfaction, I did that. So you can test how your heart muscle has improved in a variety of ways, and you can ask your any healthcare professional to help you assess your improvement. And one thing I would do if it that I do myself, so I'm not giving any information or any advice that I wouldn't follow myself. I do follow what everything that I'm telling you is that do KAATSU daily. That doesn't mean that I go for a walk with KAATSU daily, but it does mean that I'm doing KAATSU daily. And I'm actually doing KAATSU probably, I don't do it every day, twice a day, but I do it a lot of days, twice a day. So call it 1.5 times per day on average over a course of a year. The frequency or regularity of doing KAATSU is very important. We have had people who do KAATSU for 2 weeks and then they say, okay, I'm finished. And they hope that the effects of KAATSU will continue for the rest of their life. And that's not the case. Same thing holds true for almost anything in life. If you're a PNS and you're a great PNS and you don't practice for 6 weeks, you go back, you're not going to be as good. Athlete is the same way, and our bodies are the same way. So I always recommend frequency of use of your KAATSU equipment is critical to increase improvement. Um, Next question is, I have an ejection fraction of 19, which is quite low for those of you who aren't familiar with ejection fraction. How can I improve this? How can I improve my ejection fraction? I have no artery blockage, just the heart is damaged and not functioning properly. So, um, KAATSU, we have to understand, KAATSU helps increase the elasticity of your vascular tissue. However, there are also other things going on in your life concurrently. So, in other words, you can be improving to some degree the elasticity, but at the same time, if, for example, um, you are eating poorly or not exercising or having tremendous stress or not sleeping well, then the inflammation within the vascular tissue will not only offset but overcome the effects of KAATSU, which is what happened in my case. So, in other words, prior to my own heart attack, I was doing KAATSU frequently, but I was also sleeping very, very poorly over many, many years. And ultimately, the the inflammation in my heart, because the inflammation of the arteries in my heart overcame the benefits of KAATSU. So I had to rethink how I address sleep duration, quality in my own life, even though I had been doing KAATSU. So in your case, you have a very low ejection fraction. It's important that you, because of your heart is damaged, it is important for you to understand how you got to that point. Is it genetic? Is it lifestyle related? And if KAATSU is the appropriate, uh, is is KAATSU appropriate to be part of your treatment plan? And I would argue, in most cases, it is. But again, because your ejection fraction is so low, there are part of your treatment plan has a variety of issues that you must address. Your cardiologist knows you best, and so you can work KAATSU into that program. You can. But there may be some mitigating situations where it's best just to lay off KAATSU or not even start KAATSU. That is information that we as a manufacturer, developers of KAATSU do not know. That is information only your medical professional knows because he or she is reading your blood work and everything else that you have in your body that's going on in your body. Let's see. Related to the question about ejection fraction. So, my ejection fraction obviously got all the way to near zero. Um, and gradually over the course of years, I've been able to increase that. Now, that increase, I would argue, is was best reached because I learned how to sleep well. If I had done continued to do KAATSU and slept poorly and very short periods of time, I probably would not be here. So KAATSU was part of my program, but I had to address all the issues with KAATSU. Okay. Uh, the next question is, can KAATSU be helpful for someone with mitral and aortic valve issues? Um, yes, it can be helpful, but again, you have to discuss with your uh, medical team what are these issues, what is the treatment plan, and how can KAATSU be part of that treatment plan? Um, Next question is, I wonder what one does in an emergency situation with a limb bleeding and the need for a tourniquet to save your life. And you don't know if that individual has a stent. Um, I don't know. Um, I uh, well, obviously, if you're in an emergency situation and you've got and you are bleeding and you're bleeding out or your artery is somehow compromised, and you absolutely need a tourniquet. The first priority is to remain alive, so you absolutely need a tourniquet to save your life. At that point, whether the person has a stent or not, the first priority is keeping the person alive. So in and I have saved people. Um, I've done channel crossings, etc., and I've had to dive in the water to save people. First issue is always to save a life. Thereafter, you can allow the medical professionals, the EMTs, the paramedics, the emergency room doctors to help continue their care until they recover. So first priority, put on that tourniquet if they're bleeding out, whether or not they have a stent. It's not your responsibility as a volunteer first responder. I believe there's it's a Good Samaritan law that protects you legally to attempt to save a life. Call 911, allow the medical professionals um, to do what their job is. Okay. And now I'll begin the non-cardiac related questions. Um, First question is, I had a sh shoulder replacement surgery 6 days ago. I'm doing KAATSU on my good arm, and after that, I'm doing KAATSU on my legs. My arm is still very swollen, and I want to know if KAATSU is helping with the swelling. How many times should I do it during the day? So yes, shoulder replacement is a serious surgery. You do get swollen, and the swelling may be due to a variety of reasons. Um, uh, because the arm is swollen, the arm that you did the uh, surgery on, yes, it is. That was a very good approach that you did. You're doing the cuts on the arms and the legs. Um, it may sound counterintuitive, especially if you have swelling, but always remain well hydrated when you're doing the KAATSU, even if you're in this situation. Personally, I would do it at least twice a day, but I know there are some athletes and soldiers who do it more than twice a day. When I generally define once per day, that is 6 KAATSU cycles on the arms and 6 KAATSU cycles on the legs. And that's a lot of KAATSU. That's about an hour and a half of KAATSU, or about an hour and 20 minutes of KAATSU. So doing that in the morning and doing it again in the evening, for me, if I were in your situation, that's what I would be doing. More than that, there are people who do more than that, but they're type A personalities, um, and they literally want to get back in the game quicker. You may be that situation, but again, because you're quite swollen, I would tend to, and this is just my personality, to go moderately rather than full blast, especially since your surgery was only 6 days ago. Next question is addressed to Chris. For endurance athletes and master swimmers or adult swimmers, how do you incorporate KAATSU into training blocks without compromising shoulder recovery or aerobic efficiency? Is there an ideal weekly structure you recommend? So Chris is actually on his way to do KAATSU on some athletes right now. I believe he's in a car. And Chris, are you there? Can you talk?
Yeah, Steve, I'm here. Yeah,
Okay. Did you hear the
yeah,
question?
I,
Okay.
I sure did. I sure did.
Okay, go
Yeah,
ahead.
so that would be a webinar in itself, right?
Yes.
So, you know, the first thing to understand is would this individual be using KAATSU in part of their dry land strength training, in their recovery, or actually using it in the water? As you know, we have a whole modality of KAATSU aqua. So that would be the first question I would ask this individual. But my answer would be yes, would be my answer, and it would just be what I would recommend, Steve, is that maybe you could put for this individual, you could put my email address, and I could give
Okay.
them a much more detailed answer on how to approach it at all levels of their, especially if they're a master swimmer.
Yeah. Okay. I'm doing that right now. And Jason, you can rewrite that question, just cut and paste that question and send it to Chris's email, and then he will get together with you and Coach Jay to give you a more detailed answer. Okay. Next question is, let's see. Oh, there's 23 more questions. Just going down. Next question is, could regular use of KAATSU assist with deep sleep and REM sleep? Yes, absolutely yes. But it's a different type of KAATSU application. And this is what we do for we call it our KAATSU sleep protocol. So do KAATSU on your arms, only KAATSU cycle. Make sure you're relaxed and you could be watching TV, you could be reading, you could be meditating, praying, whatever you do towards the end of your day or evening. Try to do the KAATSU within an hour of going to bed, your intended sleep time. Now, if it's 2 hours, that's okay, but get it close to your sleep time. Do KAATSU on your arms. Start on low pressure. You can increase to medium and high if you wish. Then do very simple movement, nothing vigorous. What you don't want to do is bicep curls or push-ups or squats or anything. What that's going to produce is it's going to produce an amount of adrenaline, and then incremental amount of adrenaline is going to keep you awake instead of help activating your parasympathetic nervous system and helping you go to sleep. So what you want to do is you want to just do shoulder rolls forward, shoulder rolls backwards, maybe do some simple tricep and deltoid stretching, maybe move your neck forwards and backwards, side to side, around and around, especially if you've had a hard day in the office or it's been a stressful ride back with commuter traffic, whatever it is. What you're trying to do is you're trying to put your body in a restful state. And why do you use the arms? Because when we're stressed out, or even when we're not stressed, but we want to improve our sleep hygiene, our sleep quality, what you want to have before you go to bed is a relaxed vascular tissue in your neck. You want that good blood flow between your brain and your torso. And doing the simple KAATSU cycles on your arms an hour before you go to bed helps relax this upper part of your body. That will enable you to get into a deeper sleep quicker. Some people start this protocol, and immediately that day, if they're wearing a Whoop device or an Apple Watch or a Garmin watch or any of their sleep trackers, they see improvement. Other people take 2 or 3 days of this repeated use to see improvement. And so you can do it on your legs. Some people just do more on their legs than their arms. In that case, I would do the same. Sitting down, doing the KAATSU cycle with the 1 finger tightness. Now you're going to do 2 or 3 finger tightness if you have some cardiac issues or you have a ejection fraction of 19, for example. But these are some of the things you can do to help improve your deep sleep and REM sleep. Next question is, many people who took the COVID vaccine have reported lingering issues, cardiovascular fatigue, inflammation, circulation challenges, and overall reduced performance. Have you seen KAATSU play a role in helping people safely rebuild vascular elasticity, improve blood flow, or accelerate recovery in these cases? And if so, what protocols or precautions do you recommend for individuals using KAATSU as part of the post-vaccine wellness or rehabilitation plan? Now, everything that you mentioned, rebuild vascular elasticity, improve blood flow, or accelerate recovery in these cases, was exactly why KAATSU was developed. Now, when Dr. Sato, Dr. Nakajima, Dr. Morita in the 80s and 2000s, there was obviously no knowledge of the COVID or the vaccines at that time, but everything that you mentioned was the goal, was the very specific goal. It's part of our patent portfolio. This is what we were trying, or Dr. Sato was trying to achieve. This is why Dr. Sato taught me what he and Dr. Nakajima were doing and the protocols to achieve that. Again, frequency is required. KAATSU cycle is required. Again, when you going back to that river, with the KAATSU cycle, the banks of the river narrow, you get an engorgement of blood. When the banks of the river go wide again, figuratively speaking, meaning the KAATSU cycle bands are deflated, and your veins go back to their normal circumference. Then the blood rushes out. When it rushes out, that actually helps that vascular elasticity and improve blood flow. So that in itself is usually the first step in helping with all of the uh, issues that you talked about. That again, the circulation changes, the overall reduced performance, the cardiovascular fatigue. Some of those things are not exclusively due to the elasticity of your vascular tissue, but we're talking about KAATSU. So KAATSU is not, we don't claim it to be, and it is not something that will cure all in all situations. So we know exactly where our lane is. We know exactly what we're trying to achieve with KAATSU. And so if it does relate to cardioelasticity, improved blood flow, and that blood flow could be addressing tendinitis, it could be addressing PTSD. But again, this is our lane and this is where we're going. So um, in your case, I would recommend following the standard KAATSU cycle protocols. And this should help you if it is in all related to vascular elasticity and blood flow. Uh, Next question. Do you happen to have a Black Friday special? Pricing coming down for the C4. Yes, we do have a Black Friday special. We also have a Monday special. So the Black Friday will obviously start on Black Friday, and then Cyber Monday the following Monday. So those 2 days will have a special. I think we're having an email go out today. In between Black Friday and Cyber Monday, I will be holding with Chris a series daily, actually, webinars where we'll just sort of, it'll be like a uh, general Q&A session. I won't necessarily address any issue, but for those new users or even um, current customers who have any specific questions, we will be available every week during Black Friday and Cyber Monday to address any questions that you may have. Um, uh, Please provide the entire KAATSU phone number. I have scoured the website and could not find it anywhere on the web. Okay, I'm going to share my screen. Let's see, let me pull up our website. So I will show you actually um, where you can find our, okay, here we go. Then let me share my screen. I'm sharing my screen. This is our website here, kaatsu.com. There is a support, so you can go to support. There's all these issues here. And then you can go way down at the bottom of the screen, I'm sorry, of the website. And here you have company info and you have contact. So in kaatsu.com, scroll to the bottom. You can also go to support, but you can go scroll down all the way to the bottom and hit contact. And here you can input your information. You can ask a question that's sent to our customer service team. They answer it. Sometimes it's can you provide information for a cardiologist? And right here, we attach the files. You can also click on phone, and you can see our phone number is right here. And we do have 4 people, six if you count Chris and I, and they're available Monday through Friday, although Chris and I work 7 days a week. So we're answering emails as they come in if we're not asleep or in an airplane. So that's the number there, 1-888-352-2878. So you can ask any questions there. And so I'll stop my screen. Let's see. Next question is, I'm wondering if I created heart failure by using KAATSU over the last few years incorrectly. Although I only know my left ventricular output has decreased to 30% from a normal 60%. And we'll find out if there is a blockage in the ventricular. I highly doubt that KAATSU, because this questioner actually asked the same question maybe a few questions ago. If I believe you were using it 3 times a day. I'm sorry, you're using it either 3 times a day or 3 times a week. You're starting at low, medium, and high, using the cycles on a Aerodyne bike, walking and cycling. So by all means, you were using it correctly, and the ventricular output has decreased. Now, when the blood goes out of the heart, it can be decreased for a variety of reasons. And if you're using KAATSU would definitely not. It's actually physiologically impossible for it to decrease your output. So, as you mentioned, you'll find out if there's blockage on your next hospital visit, and let's hope there is not, and it perhaps is some other issue. Let's see. The same person asks, here at University of Florida Health, heart failure is managed with 4 medications: a beta blocker, hypertensive, and 2 other diuretic meds, all geared to stabilize the heart. There is no promise to reverse, only to prevent further failure, and of course, a stent if needed. Okay. The next question. Are there any special approaches for diminishing inflammation due to increasing EMF, especially 5G? Okay, so are there any special approaches for diminishing inflammation? I assume the question is with KAATSU, due to increasing EMF, so electric magnetic frequencies, especially 5G. So in our society, unless you have a special home that you've outfitted in a special way, you don't use smartphones and a variety of other electronic gear, you're probably going to be impacted by some way by the new 5G networks. So the assumption here is that it's creating inflammation creating inflammation. I assume that's creating inflammation in the vascular tissue. And with KAATSU, the approach is specifically exactly what I've been explaining before. Well hydrated, seated, frequent, KAATSU Cycle uses at low pressure with a one finger tightness on a daily basis. You can increase your vascular elasticity or the rate of improvement of vascular tissue if you do simple exercises. Now, if you're interested in also sleep quality, those exercises might be stretching your deltoids and stretching your triceps. It could be as simple as shoulder rolls, or it could be something like walking at a casual pace, doing some sort of resistance work. It could be holding two water bottles and moving them up and down. It could be standing on one foot. It could be wall sits. It could be something more vigorous, like the previous gentleman who works out on a aerodyne bike. So all of these are ways that you can diminish the rate of inflammation. But again, our bodies, as we age, there are other factors that we have to do. So KAATSU is one part of a total whole. And if you follow the protocols that we discuss, then um, things might not be perfect, but they'll be better than doing nothing. That is definitely for sure. Next question is, I have an irregular heartbeat, sometimes fast, not for too long, and an enlarged heart. Is this something KAATSU can help and how? My ejection fraction is 35%. I have mild edema in my lower belly, but am overweight and sleep only 4 hours a night. Okay. So sleeping that few hours a night itself is is an issue. I know that from personal experience. Um, but you have a lot of issues here. You have a low injection fraction, you have a regular heartbeat. Sometimes your heartbeat gets fast. You have an enlarged heart, meaning your heart muscle is getting larger. Um, KAATSU isn't something that reverses all of these. It, that is not why Dr. Sato created KAATSU. So you have a lot of issues here. And again, KAATSU can be part of the overall treatment, but it can't reverse things that it was never meant to um, uh, address. So again, if you can talk to your medical professionals, come up with a treatment plan. You can share it with our customer service team. That your question will undoubtedly get to me with give us as much information as your medical team can provide to you. Then we will help you work in KAATSU to a solution. For example, you said you only sleep 4 hours a night, but there was a previous question about can KAATSU help with deep sleep and REM sleep? And my answer was yes. And so part of your solution with KAATSU could be following that sleep protocol. So doing KAATSU twice a day with the second one within an hour of bedtime, doing very light exercises. So this is what I mean by having KAATSU as part of your overall solution. Um, Thank you for sharing. Next question is, thank you for sharing how your sleep patterns affect your cardiovascular health. I have the same sleep issues. Would you please share how KAATSU helped to improve your sleep quality? So one, the ability for me to sleep deeper was due because I had used KAATSU towards the end of the day. Previously, I was using KAATSU in a more active state. So I was walking with KAATSU. And when I was walking with KAATSU, I was actually also just doing some air, what do you call it? Air bicep curls. For example, I was doing KAATSU aqua. I was using KAATSU in the water. I was doing a lot of what I now look back on as vigorous KAATSU. So I was doing KAATSU while I was being active. Post heart attack and post my own focus on sleep quality, I was doing KAATSU passively, meaning while I was sitting down working on my laptop or talking or writing, doing something that I was doing what I call micro movements, whether that's moving your head back and forth or doing some slight stretching, but not active movements as walking or even moving my arms as a bicep curl. Big difference, at least for me, in a bicep curl with cuts on my arms versus simply typing on my laptop. This is a micro movement. This is exercise. And so I shifted post heart attack from an active form of KAATSU to a passive form of KAATSU with micro movement at times. When that happened, my sleep quality definitely improved. I don't wear a Whoop device or any device that measures my sleep, but I was definitely sleeping longer and I was waking up fewer times. And when I would wake up, I was refreshed. That is how I judge my sleep quality improved with this movement from an active KAATSU to more passive KAATSU with micro movements. Next question is there a protocol for traumatic head injuries? Um, yeah, so obviously with football players, soldiers, even divers, platform divers, wrestlers, water polo goalies, soccer players, car accident victims, mountain climbing individuals. We've had many people with traumatic head injuries. Our most famous example is Green Beret by the name of Joe Lowry. When I met him, he had just been released from what do you call it, a brain treatment area for traumatic injuries. He took a bullet to the head as a Green Beret in Afghanistan. So here, very much like people with cardiac issues, we have to use KAATSU very, very gently. So the same way that I used it post heart attack in a very passive means, meaning not while doing something active like, bicep curls or walking, even walking. I started to use KAATSU as I was seated, as I was doing micro movements as I was talking. This is how we would treat this is how we would recommend somebody with a traumatic head injury use KAATSU. So not while they're walking, not while they're doing any exercise. And that means including washing the dishes, including folding the clothes. Um, we want you to be seated calmly, and doing the KAATSU cycles on low pressure. No need to go high pressure. Next question is KAATSU helpful for Raynaud syndrome? So Raynaud syndrome is where the elasticity of your digits, the end of your hands, is lower. If you look at someone with Raynaud's disease, typically their fingertips are white. Raynaud's disease is something that you should be uh, both cautious and hopeful about. And why is that? Because you have a, a condition. This is endemic in your body. KAATSU cannot reverse that. So, when there's a disease, KAATSU is not something that reverses or heals a disease. It works on increasing the vascular tissue. Now, because and we have a lot of KAATSU users who have Raynaud syndrome or Raynaud's disease, and they put the bands on with a 2 or 3 finger tightness. So in other words, where's my band? It fell, but you put on the band normally and you put it so snugly that you can only put 1 finger in. But with KAATSU, I'm sorry, with Raynaud's syndrome, we don't want you to put it on so tightly. We want you to put it on much less tightly, usually a 2 or 3, mostly 3 finger tightness. So it's on rather loosely, and then you allow the bands to inflate and deflate. The reason why we do this is because people with Raynaud's syndrome, if they do use KAATSU the way other people, other normal or people without Raynaud's disease use KAATSU, then what happens is during KAATSU, everything tends to be fine. It's afterwards, it's after these capillaries here, which do not naturally stretch out normally, all of a sudden they've been forced, blood has been forced in those small capillaries, and it literally hurts post KAATSU. So obviously, if something hurts, somebody's not going to continue it. Therefore, we mitigate that by putting on the bands not snugly as normal, but more loosely, much more loosely. We only use the low pressure mode, and we gently, very gently do it. And it will take time. It's the same approach we used for varicose veins. Varicose veins won't um, be resolved in a day or a week or even 2 weeks or a month with KAATSU. But if you take time and have patience, and not everybody does, you have time and patience doing that very low pressure, very not traditionally snug um, fitting of the bands on your arms, or that will allow the syndrome that your body has naturally to be mitigated, not to go away. Next question is, would lying down versus sitting down using KAATSU be okay before bed? Yes, that's fine. In fact, we there is a video, um, and I don't want to disturb this discussion, but we made a video actually for three-letter agencies. Three-letter agencies in the United States are things like the FBI, CIA, DEI, what is it? Firearms and something, DA, DA. Anyway, the basic law enforcement individuals, because uh, it was years ago, they were advised to um, not use for example, hotel gymnasium or fitness room, etc. So we put a video together so they would learn how to use KAATSU when they're on their trips and travels in their room. So instead of going down to the hotel fitness room, they would spend time in their room working out and then getting ready for a good sleep, because they're obviously people who face a tremendous amount of stress. And in there, we part of that is actually in the hotel room where I am right now, in a hotel room. And you're in bed. Generally, it's a lot easier to put the bands on your arms in bed instead of on your legs under the covers. Then what you do is you do the same things. You don't need to be sitting down as I am right now. You could be doing the same thing lying down, perhaps reading a book or whatever else you're going to do in bed, including watching a movie, let's say. So lying down is perfectly okay. In fact, when we're working with paraplegics or quadriplegics or anybody who's bedridden, they're usually in a supine or laying down position. Next question is, I learned about KAATSU from Dr. Mercola, but he recommends the B2, not the C4 model, because of the EMFs being emitted from the C4. Do you have a view on this? Thanks. The amount because of Dr. Mercola, we actually measured the amount of EMF that is emitted from all our products, and it was extraordinarily low. It's not zero, obviously, but it is low. And EMFs were actually emitted while the compressor was on. So let's say you do 3 cut cycles, that is a 90 seconds of EMF, 90 seconds of EMF. And I don't remember the name of the units that it measures, but we have that study somewhere. I think if you email us at info@kaatsu.com, we can provide you with that study so you know precisely, um, at least in one study, how we measured EMFs and what it's related to. And I remember the person who did the studies, I think he summarized it something like the amount of EMF was even if you did 6 cycles and 6 legs, was equal to the amount of EMF that you would get on a digital clock in a room. So um, it's not nothing, it's not zero, but it's not a lot. Um, Next question is, will using armbands benefit the entire body if that's all one can do? Very interesting question, very good question. Reason why is um, sometimes I use KAATSU with my wife. We have one set of bands, one set of arms, one set of legs, and we can go for a walk with our dog. She can be using them on her legs. I use them on her arms. I'm actually walking with the cuts on my arms. So in your case, if you only have KAATSU armbands, you can still do core exercises, you can still do squats, etc. that will benefit the entire body. That is not a problem. And the reverse is also true. If you only have leg bands or you only like using leg bands, you can always do have the leg bands on, go for a walk, or maybe you're in a gym or around the house, but you can be moving your upper body as you have the leg bands on. So that's the beauty of KAATSU. There are systemic effects that you can affect by having bands either on your arms or your legs. Next question. Is KAATSU contra in is use of KAATSU contraindicated with a pacemaker? Um, yes, it is contraindicated. That being said, people with pacemakers do use KAATSU. So I just sort of said yes and no. And how do you decide the validity of that yes answer or the no answer? And it is the same thing that we've been saying before, is that the um, explain KAATSU equipment, explain KAATSU protocols to your cardiologist or your healthcare professional. Have them see the KAATSU, or if they want, we can send them papers, scientific papers published in journals, so they can read more about KAATSU. So yes, it's contraindicated. We have a long list of contraindications, um, and those were actually created by Dr. Nakajima, who used KAATSU on 12,000 patients during a study. So that's a yes and that's a no. So it is possible, but please seek the advice of your healthcare professional first. And here we go. The last question is, I have to wear compression stockings for varicose veins. Can I use KAATSU with the compression stockings? Um, I would recommend no. So the compression stockings are impacting your vascular uh, condition on the lower part of your leg. And then you have KAATSU on that is actually doing something that's not consistent with the compression stocking. So when you're doing KAATSU, again, if you don't have to wear them 24 hours a day and your healthcare professional says it's okay, I would remove the compression stockings, use KAATSU, and then once the KAATSU session is over, I would put put the compression stockings back on. So, whoa, there was 36 questions there, I believe. Oh, do we have any more? Let's see. I think I think we got them all. I know for some of you, I recommended that you send us an email, info at kaatsu.com, and either Chris or myself or our customer service team will answer them and we'll provide you information, studies, data, specific exercises or movements that you can do to help yourself. So I thank you very much from a hotel room in Japan. And sorry about the bad lighting. And I wish you well. And for those of you who have friends, and they might be interested in KAATSU, we do have a special deal, our best deal of the year on Black Friday and Cyber Monday. And I hope to all see you and join you on your own KAATSU journeys. So thank you very much and take care. Be well.